Approximately every 3 minutes, one person in the United States is diagnosed with a blood cancer. Blood cancer is a disease that affects the blood cells and the platelets. Some of the main types of blood cancer are leukemias, lymphomas, multiple myeloma, and myelodysplastic syndromes. Myelodysplastic syndrome is a group of blood disorders that affect the bone marrow. The bone marrow is not functioning normally in these patients, and it really is a pre-leukemia state. In acute leukemias, abnormal cells are growing very rapidly, and what happens is the abnormal cells will crowd out the bone marrow and will then affect the production of the healthy cells. Lymphoma is a disease of the lymphoid cell and the lymph nodes. The abnormal lymphocyte is multiplying rapidly, but they may or may not be circulating in the blood. They may be forming masses or abnormalities in the lymph nodes. Multiple myeloma is a disorder of the plasma cell. That's a type of white blood cell. And normally that white blood cell is making antibodies that help us to fight off infection. In someone with multiple myeloma, the plasma cell is dividing more rapidly. Those abnormal plasma cells will crowd out the bone marrow and make abnormal antibodies, which then ultimately can affect the immune system, and patients can have recurrent infections. There are many different treatments for blood cancers, including radiation, chemotherapy, immunotherapy, cell therapy. 30 years ago, there were far less patients ultimately achieving the cure and long-term survival with various types of blood cancers. Now, with newer treatments and better treatments, patients are surviving and they are living normal lives.